Yes, dear students, so today let us be study about the toxic effects of mercury, cadmium, lead and arsenic. These metals they have a toxic effects both in plants and animals. Now today let us be study about what are the toxic effects of mercury. Mercury is more common than you would think. It can be found in thermometers, fluorescent light bulbs, batteries and other harmful items and also household items. Below are some of the side effects of mercury can have on the human body. Some adults can have inflammations of the gums, which is also known as gingivitis. Adults can experience upset stomach, severe exposure can lead to kidney failure in adults. Pregnant women need to be especially careful because certain levels of exposure can affect fetal brain development. Both adults and children may experience numerous the tinges and rashes can appear on various parts of the body. Both adults and children can experience mental confusion, some irritability, memory loss, shyness, or withdrawal. Tremors are also common in adults. These symptoms are more corrosion, sorry, these symptoms are more common in adults but have been prevalent in exposed children. Children may experience swelling of the hands and fingers. The skin may also peel. Children who are exposed may also have swelling and peeling on their feet and the toes. This slide shows about the sources of mercury. So the mercury, elemental mercury, you find in sphygmomanometers, thermometers, barometers, in amalgam filling as a liquid. It is a liquid at room temperature, volatilizes easily. So this inorganic mercury, so it's a find in traditional remedies like Ayurvedic, Chinese medicines. It is used in gold extraction, caustic soda manufacturing units, and also rodenticides. Organic mercury is used as the fungicides, seed dressings. Methyl mercury is found in fishes. This slide shows about the mercury effects on animals. Reduction of loon chick reproduction are found in lakes where mercury concentration in eggs are toxic. It affects diving ducks, herons, egrets, etc. at bodies of water where high concentration of mercury are found. It can cause deformities in developing animals. Exposes methyl mercury to living things that consume a lot of mercury contaminated fish and seafoods. Now this slide shows another, that is the toxicity of mercury. You find the toxicity of mercury, it affects the algae, it affects on plants, it also affects on animals, and also the human beings. The all plants concentration, the mercury. So what it does, it's the concentration in edible plants ranges from less than 1 to 300 nanograms per gram, and its concentration also depends on soil, plant species, chemical form, and social aeration. Some plants battle to uptake due to inorganic mercury and organic adsorbed on clay. Some plants no barrier against gases. Mercury uptakes through roots. In soil, sulfide decay releases gaseous mercury. Plant absorbs mercury about 0.2 to 10 microgram per gram in dry weight. So this is about the mercury. And also the last slide shows the health effects about the mercury. So the mercury, it deteriorates nervous system. It impairs hearing, speech, vision and gait. It causes involuntary muscle movements. It corrodes skin and mucous membranes. It causes chewing and swallowing to become difficult. So these are all the mercury effects. Coming to the cadmium. Cadmium is a well-known heavy metal toxicant which is widely used in mining, metallurgical operations, electroplating industries, manufacturing vinyl plastics, which used in metallic and plastic pipes. Effluents from such activities are the sources of cadmium into aquatic environment. Let us study about the cadmium toxicity. Research has shown that cadmium affects the developing brain in children. Here are some other parts of the body it can also affect. A recent study has linked it to breast cancer. So cadmium toxicity gives the cardiovascular diseases. Obstructive pulmonary diseases also you find because of the cadmium toxicity. The cadmium toxicity leads to kidney loss function, which can also cause the gout, a form of arthritis. Bones lose density and fracture. The cadmium poisoning gives in the respiratory system, so the destruction in the respiratory mucous membranes. So it affects to the kidney also. In the reproductive system, testicular neurosis, estrogen-like effects, so affection of stored hormones synthesis. So all these things leads to the cadmium poisoning. It also it affects to the skin, that is the loss of bone density and mineralization diseases. So the cadmium also causes in plants the germination delay, membrane damage, improper food metabolism, mineral leakage, lipid peroxidation, altering redox regulations. So all these things we may get because of the cadmium poisoning. Coming to the next one, that is the lead poisoning. Lead built up in the body causes serious health problems. The symptoms of lead poisoning are headaches, irritability, reduced sensations, aggressive behavior, difficulty sleeping, abdominal pain, poor appetite, constipation, and finally the anemia. These are all happens because of the lead poisoning. Additional complications in case of the children are loss of developmental skills, behavior, attention problems, hearing loss, kidney damage, reduced IQ, slowed body growth. So these are the symptoms you come across in children. The lead toxicity effects. So the lead toxicity effects are learning disabilities, hyperactivity, diminished cognitive development, slow growth, loss of synaptic plasticity, hearing loss, headache, neuropathy, renal damage, reduced dermal sensitivity. So these are all the toxic effects of lead. So here also the same things are given in another, what you can say, the format. That's all. So how to prevent childhood lead poisoning? So this can be prevented by exposure to lead can seriously harm a child's health. It damages to the brain and nervous system. It slows growth and development, learning and behavior problems, hearing and speech problems. This can cause lower IQ, decreased ability to pay attention, underperformance at school levels. Coming to the another element, that is arsenic. So the toxic effects of arsenic in human beings. Arsenic is a poison and its lethal dose for human is 125 milligrams. It is 4 times as poisonous as mercury. Toxicity depends on the amount of arsenic intake, which is classified into acute, subacute, and chronic toxicity respectively. Drinking water contamination causes the last variety of toxicity, that is chronic toxicity. Most of the ingested arsenic is excreted from the body through urine, stool, skin, hair, nail, and breath. In excessive intake, some amount of arsenic is deposited in tissues and inhibits cellular enzyme activities. Almost all organs are affected, but clinical symptoms appear insidiously after 6 months to 2 years or more, depending upon the amount of arsenic intake. So this slide shows about the arsenic effects on the human body. So it impaired intellectual functions, impaired motor functions, and neuropathy. These are all belongings to nervous system. So it affects the cardiovascular system, causing coronary heart disease, hypertension, heart attack, etc. It affects the renal system, that is the kidney cancer, bladder cancer, and so on. It affects to the skin and the skin lesions, skin cancer, and so on. If it affects to the endocrine system, that is the diabetes, impaired glucose tolerance in pregnant women. It affects to the respiratory system, causing pulmonary tuberculosis, bronchiosis, lung cancer, liver cancer, and so on. For the children, gives increased cancer risk as adults, increased infant mortality, neurological impairment, reduced birth weight. So these are all the effects of arsenic. So in another way, we can say arsenic affects broad range of organs and systems including skin, nervous system, respiratory system, cardiovascular system, liver, kidney, bladder and prostate, immune system, endocrine system, developmental processes. So these are all the effects of the four elements, that is the mercury, cadmium, lead and arsenic.